Hello, this is Dr. Tom Nichols, and this is a training video to explain how to use the Patient Directive Decision Matrix as part of the Digital Proactive Care Plan. It assumes that you already have the software and it has been activated, and that you now wish to use the Decision Matrix as part of your care planning process. This is the medical record of one of my test patients. This is not a real person, and so there is no confidential information. First, I'm going to press F12 and launch my OCCG Care Plan Quick Launcher. This time I'm going to proceed directly to generating a decision matrix as a standalone document. The Patient Directive Decision Matrix was devised as a tool in order to reflect the permissiveness which many patients feel towards accepting that they will not have full aggressive treatment for every single health problem that they have, and already has an evidence base for preventing unnecessary admissions in the care home setting. My personal experience of using this tool is that for the right patient it's extremely clinically valuable and a really good platform for discussing people's preferences. The decision matrix composes of a grid. The first line represents normal preventative treatments, and each line going down the grid represents a more extreme situation in which people who have very complex health problems or may be approaching the end of their life may wish to communicate decisions to facilitate more treatment outside of the hospital setting, including dying at home. For the purposes of this demonstration, I'm going to record that my patient does not want to have preventative treatment for future problems, but that they would accept some basic investigation in general practice. If they become ill, they would accept some basic treatment at home, but they would prefer not to be hospitalised. And in the event of a probable end-of-life illness, they would rather be kept at home. Although this statement is not a do not resuscitate statement, it's another convenient place to summarise the resuscitation status. On the bottom of the document is the date that the document was completed, and checkboxes to record who was present during the discussions. You will notice that there are no signature strips on this document, and the reason for that is this is best thought of as a recording of the discussions which took place on that specific date. If a patient wishes to have a legally binding advance decision to refuse treatment, this must be drawn up with a solicitor who is trained in the Mental Capacity Act, and so this document does not need to be signed. I'm going to click File, Save and Close. And if I access the document section of this patient's record, you will see that it's been filed as a decision matrix with the code Preferred Priorities for Care document completed. In addition to the standalone document, within the Care Plan Quick Launcher tool, you will also find that if you prompt the software to generate a draft plan, you will be asked whether you want to include a draft blank matrix ready for printing out. In this situation, the draft document has a final page, which is a blank decision matrix. But also, when you finalise the document, again, if I press F12, load my Quick Launcher, and generate a summary plan, I will also be asked whether I want to embed a decision matrix into the document itself. I'm going to click Yes. I want all of these problems to be merged, so I'm going to click OK, and all of these medications. At the moment, it's not possible for the decision matrix to be coded fully into specific read codes, although I have made an application to the people who produce the read codes, so that in the future hopefully it will be. If I scroll down to the bottom of this page, I have an empty decision matrix where I can record the discussions which I had as part of the care planning process. I'm now going to save and close the document. I can see from the title of my document that this particular care plan does have a matrix built inside it. This is quite convenient because I can send one document to the out-of-hours service which contains all of the information. Because it's not possible to record this data as specific read codes, there is an issue about how to handle the situation if a decision matrix was generated previously and does not need to be altered for an updated care plan. I have open here a summary care document, and I know that there was a previous decision matrix from earlier in the year. Without closing the document, it is possible to go to the document section of the medical record using this tab, to find the previous decision matrix, and double-click on the item in order to load it in a viewing window. Here I can review the content from the last decision matrix, the date and who was involved. I can close the viewer and then return to my summary document in order to recreate the same buttons as before. An alternative would be to print the previous decision matrix and have a paper copy side by side. I'm hoping that in the future we will have a set of read codes to fully automate the recording of the components of this decision grid, and with a bit of luck we'll be able to do so by the end of 2015. One final point is that the resuscitation status still needs to be documented on the official Unified Do Not Resuscitate statement. Once again, if I press F12 and load my Quick Launcher, there is a copy of the Do Not Resuscitate form buried within the software of the Digital Proactive Care Plan, which can be used to rapidly generate a Do Not Resuscitate statement. The first prompt which appears is simply for instruction. Page 1 of the document contains details about how to complete it, and for the patient's property, page 2 of the document needs to be completed on lilac paper. So page 1 here are the instructions, and page 2 is the Do Not Resuscitate statement, which needs to be printed and faxed to South Central Ambulance Service. And the signed copy needs to be scanned and emailed to the out-of-hours service, along with the rest of the care plan. Thank you for watching.